Fortification is basically adding something to food to make it more strong. One food is there, you're adding something to that food to make it more strong. So, to improve the quality of the diet, okay. So, it was first used during World War, they used iodized salt. Then they also used niacin in USA, vitamin D, margarine, and in India we used vitamin A and D for dalda. Okay, so these are all examples of food fortification. That means you're adding nutrients to the existing food. Again, folic acid was added to prevent neural birth defects, and this in recent times we have had a lot of additions of food fortification in various things to combat deficiency of vitamin A, folic acid and iodine. Okay. So, this is the definition of fortification. It is a purpose of preventing or correcting a demonstrated deficiency in the population of specific population groups. Okay. So, this is the specific thing regarding food fortification. So, these are some of the things in which food is fortified. First one is ICDS scheme. ICDS means basically Anganwadi. If you go to an Anganwadi, you will find that food is given, supplemental food. That is in Anganwadi. Then you also have midday meal, then also fortification of factory produced ready to eat food, and fortification of wheat in public distribution system. The public distribution system means ration card, ration shops. Okay. So, all these are examples of food fortification, government sponsored programs. ICDS, midday meal, ready to eat food, and targeted public distribution system, which is ration shops. So, what are the vehicles we normally fortify? So, fortifying, you can't fortify everything. So, you have to use something which common people take. What do they take? They take salt. So, you can add something in salt. You can add something in maida. You can add something in rice. You can add something in vegetable oils. You can add something in milk and dairy products. And you can add something in sugar. So, these are the edible common salts. You have sugar and iodine and iron. Wheat flour and maida, you have iron, folic acid and calcium. Rice, you have rice and folic acid. Vitamin A and D in vegetable oils. The milk and dairy products, A, D, folic acid, calcium. ICDs, you have iron, folic acid, and sugar, you have vitamin A. So, what is the criteria for fortification? There must be a deficiency of the disease in the population. In some population, there must be a deficiency of the disease. And what you're going to add is something which is common and it should not lead to any toxicity. So, and also if you're adding something, it should not change the color, the taste or something else. Okay. It should not change the color, taste, flavor, texture. So, these are the criteria of fortification. Nutrient deficiency should be widespread. Vehicle food must be consumed by a target group. High consumption of fortified food will not lead to toxicity. So, this is a common concern that if you add something, there may be toxic effects. That has to be proved, it is not going to be toxic. And the items of food should be centrally controlled and monitored, and it should be affordable. So, you cannot say, suppose somebody is very poor, very malnourished, you cannot add chicken to that person because it's going to be very costly. Okay. So, that is something. So, what are the approaches for fortification? Fortification, some of the approaches are rapid. First, you must know the RDA. What is RDA? Recommended daily allowances. So, how much of nutrients does that person need? Then, what is the prevalence of deficiency in that area? Say, for example, West Bengal, we normally take more rice. Punjab takes wheat. So, where is the deficiency going to be? So, if you add something to wheat in Bengal, it is not going to work. It will work in Bengal, but not in Punjab. Okay. Then, per capita consumption of food and current dietary habits of the population, which I just told you. The Punjab, the main diet is wheat. Here we take rice. And also stability of the nutrient and the chemical sources. So, the advantage is that this provides nutrients and also helps absorption of various nutrients. Like, for example, vitamin C enhances the absorption of iron. And providing nutrients to the regular food system reduces the costs. So imagine if there are 100 people and you're going to tell 100 people to buy it, rather than that if they get it from the ration shop, it becomes easier. So this is, in Andhra Pradesh, they had this thing, and again there they had the midday meals program, public distribution system, and the integrated child development scheme. These are some of the things, and again here Andhra is like West Bengal, rice is the main staple food, so you have to add it to rice. And this is what they had as, what was the fortified thali. I don't know if you can see the last at the back. This is fortified wheat flour, fortified oil, fortified milk, double fortified salt, double fortified milk. So this is a circle of nutrition. This is called the fortified thali. Okay. So these are examples of fortified food. Milk with vitamin D, salt with iodine, fruit juice with calcium, water or toothpaste with fluoride, flour with folic acid, bread with niacin. These are all examples of food fortification. Now comes to the next one, food additives. Now this is something which we all see in our daily life. Daily our habits are changing, our food habits are changing, and we always like color. Something which is colored, we always tend to take it more likely. So that's why this food additive is important. So this is also a very ancient thing. They used to, our forefathers used to have pickling. To make pickles, they would preserve it in the bottles. And then now we have food technology, food technology engineers make a lot of such things. Processed food is in a big, huge turnover. So these things have become more common. So again, you can categorize it into two categories. First is coloring agents. I mean the category, these are considered safe for human consumption. Coloring agents like saffron, turmeric, flavoring agents, sweeteners, preservatives, acidity imparting agents. These are all generally considered safe for human consumption, generally, okay. Second one is contaminations through packing, processing, farming products like insecticides. All these can cause contamination. And of course, too much food additives also can cause damage in the long run. So you have to be very judicious in your what food additives being used. So I'll give some examples. Some of them do cause cancer. Okay. So general food additives are antioxidants, stabilizers, preservatives, artificial sweeteners, bulking agents, acid regulators, flavor enhancers, glazing agents. Now remember this, all additives, and please remember this, all additives are not adulterants. We'll come to what is adulterant later, provided they are present within a specific limit. So if you have some coloring agent and it is within a specified limit, it is not considered as adulterant. But if it exceeds the limit, then it's considered as adulterant. So all additives are not adulterants until reported outbreak of food safety issues occur. So what are the additives we normally see? Synthetic colors, saccharin, nitrates and nitrosides, they cause some side effects. Like saccharin causes itching, urticaria and running nose. Saccharin can cause carcinoma of the bladder, and nitrites and nitrates can cause stomach and gastrointestinal cancer. So these are the possible side effects. And another one is MSG, monosodium glutamate. You are familiar with monosodium glutamate? That is used in Chinese food, what is called chow mein or noodles. They add that. That causes problems like chest tightness, burning sensation, and asthmatic attack. Long-term results, damage to brain. And also sodium metabisulfate and sodium sulfur dioxide they used for dry fruits, wine, etc. to prevent discoloration and spoilage. So let's make it a bit more specific to showing you the pictures. So these are preservatives. Like if you keep bread for 2 days or 3 days, what happens? Fungus is there. So sometimes many of these things they use preservatives to prevent spoilage of food. commonly used in cheese, margarine, bakery products, etc. And you have these things like sodium benzoate, sodium nitrite, benzoic acid, BHT, BHT, etc. So sodium benzoate, this is there in soft drinks, pickles and sauces. It can aggravate asthma, suspected to be a neurotoxin, and can cause cancer. So, and also may cause fetal abnormality. So if you are a habit of taking many cold drinks, tin, canned drinks, be a bit careful. This could be dangerous. Okay. Again, sodium nitrite and nitrate. Again, that is found in things like sausages, hot dogs, smoked fish, canned meat. This also is carcinogenic. So if you take tinned meat, tinned fish, not tinned meat, fish, tinned meat, if there could be a chance of nitrate and nitrate which can cause cancer, nitrate can cause miscarriages. So nitrates is there, nitrates is also there. Then again, benzoic acid is there in drinks which this may deplete glycine levels. You should avoid it in asthma and allergies. It's again found in meat products. Okay. Then even your potato chips, which you normally buy, your Lay's or Kurkure or whatever, they contain this thing called BHA, BHT, which can cause carcinogen. So again, same thing. If you're having too much of potato chips, there's a chance, theoretically there's a chance that you could be having a carcinogen. Okay. So chewing gum also is another thing which has got the same problem. So then coloring agents. We all we take soda sarbat or some sarbat, we like the coloring agents, the blue, green, whatever it is, mojito. So they are used also from coal tar or petroleum. They can cause allergy, asthma, hyperactivity. Like example, erythrocin, aloe tartrazine and brilliant blue. So erythrocin is one such thing. This can cause cancer. It's found in chilies, canned foods for salads, baked breads, dairy products. So here you have one more potential cancer causing thing. Okay. Then tartrazine. Again, this is used for various syrups, various cold drinks, squash, etc. Here also it can cause hyperactivity. It doesn't cause cancer, but skin rashes and hyperactivity, and it can cause migraine. So these are the things which are possible. Also on the ice cream, you can see the ice cream also. That's the top. That part also is what is called tartrazine. So erythrocin is one, tartrazine is another. Then aloe red, again carbonated drinks, bubble gum, soup, sauces. Here you can see a tomato soup. That same red color that can cause asthma. So most of the additives, they are either allergic and cause asthma, or they are, in the long run, they can cause cancer. That's the long and short of it. Then again, brilliant blue, again skin rashes and hyperactivity, often found in ice creams or things like that. This again is listed as a carcinogen, cause DNA damage and tumors in animals. So another food product found in dairy products, icing, blue raspberry products, all this can cause cancer, also hyperactivity and skin rashes. Then flavoring agents. So we talked about coloring agents, now flavor. We are adding something for flavoring the thing. So again, monosodium glutamate, which you use in Chinese food, which you use in Chinese chow mein or noodles. That is a form of glutamate, and that can cause, it's found all over the place. Some of them have a label MSG, some don't have the label. What you're having from the road, from the footpath wala, he may be adding MSG, but we don't know. So it's then found in restaurant foods, soups, chips, and this causes what is called Chinese syndrome, Chinese restaurant syndrome. You have shortness of breath and burning sensation in the forearms, and also they say, now they're saying neonatal exposure is linked to stunted growth. So a small child, if the child is given MSG, then there's chance of reduction in growth hormone. Okay. Then you have sweeteners. Again, non-nutritive alternate sweeteners. They provide texture and they also lower the freezing point in ice creams. Preservative in jams. So for this, you are adding sweeteners. For all your food, Whatever you're buying from outside without sweet, it doesn't look good. So sweetness, and adds bulk to baked foods, strengthens mouthfeel in soft drinks. So these are food sweeteners, even your chewing gum, like all these are sweeteners. Cornflakes, all the other stuff which you're getting, Kellogg's, cornflakes, etc. All these are there. Here what happens? They cause behavioral problems, hyperactivity, allergy, and possibly carcinogenic. Advantage is that they allow diabetics to have good food, sugar-free but sweet-tasting food. So that is the advantage of this sweetness. Then you have antioxidants. Again, they act to slow down the rate of oxidation, but unfortunately they contain this chemical called BHA or BHT, and that is butylated hydroxyanisole or butylated hydroxytoluene. Both of them are potentially carcinogenic. Again, this is found in vegetable oil, meat, fish, mayonnaise, potato products, all this. Okay. You get this in all. And again, side effects, hyperactivity, asthma, angioedema, rhinitis, urticaria, and may affect estrogen levels. And again, linked with cancer in animals. So, cancer, hyperactivity, itching. This is a general pattern in most of these things. Now we move on from food fortification is over, food additives is over. Now we move on to food adulteration. Now what is food adulteration? Adulteration means basically some food which is not intended to be added is added, but that is added for a profit or a motive. Okay. So it's a large number of factors such as mixing, substituting, removal, concealing the quality, selling decomposed products, misbranding, giving false labels, addition of intoxicants. It's a social evil. Okay. So what is the disadvantage is that you're paying money but you're not getting the product, the proper quality of things. Okay. And there is a risk of ill health is there. Now, the addition or subtraction of any substance to or from food so that the natural composition is affected. And technically includes mixing, substituting, concealing the quality, putting up decomposed food for sale, misbranding or giving false labels, and addition of toxicants. Any substance added, you will be surprised at seeing the substance added, which brings down the quality, and cheap substances, and it's an imitation. It is colored or otherwise treated to improve its appearance, and whatever reason, the quality is not up to standard. So, what are things that you can think of which can be adulterated? What is the food that you can think of which can be adulterated? Think of a common food or something which can be adulterated. What can be adulterated? Think of something. Huh? So, one is incidental adulteration, the other is accidental. Intentional is that the person wants to make some profit out of it. He wants to give some fake things. Accidental, it happens because of accidents of storage or processing. And this metallic adulteration is when it's mixed with something like arsenic. Okay. So, intentional is done for financial gain. He's adding sand, marble, or some other products to it to make it more profitable. Incidental is usually pesticides, residues, and droppings of rodents, etc. And metallic is if there's some arsenic or some other metal which is involved. So here replacement of the original thing. You're replacing the original thing with a substitute, but you're charging the price of the original thing. Second one is addition of small quantities of non-authenticated substance to mask inferior quality ingredient. You're adding something to prevent that from being known. Removal is removal of authentic and valuable constituent without purchaser's knowledge. Okay. So this is important that they say, for example, that this product contains this, but when you open the product, that's not there. It's something like Amazon or whatever online you order. You order something, but that's not what is there in what they advertise in the net is different from what you get over here. Something like that. So the patient is paying more for the food, and some of them is very dangerous. One is arginine oil to mustard oil cause epidemic dropsy. You can also add edible oil with TCP can result in paralysis. Okay. So pure milk and adulterated milk. Not a very difficult thing to check at home. just 5 to 10 ml of sample with equal amount of water, shake it thoroughly. If it is adulterated with detergent, it becomes like this. Pure milk will form a thin foam layer due to agitation. Okay. Then ghee, adulteration of ghee. Ghee is also common adulteration, and you have, they say, good ghee, bad ghee, whatever. This again, it can cause cancer or acute renal failure. And the next one is argan oil, which causes epidemic dropsy. Okay. So again, this is again another test. Detection of mashed potatoes, etc. in ghee or butter. You add 1 spoon of ghee butter, you add tincture iodine, again blue color. So blue color means it's adulterated. So otherwise the ghee should be, if it's pure, it should be like this. You add tincture of iodine, it becomes a blue color. Then this is the most important thing. Mineral oil, mustard oil, mineral oil is also added to edible oil. Epidemic dropsy and glaucoma due to argan oil, cancer due to mineral oil. Okay, we'll talk a bit about that later. So here you have 2 seeds looking alike. One is mustard, one is argan seeds. Argan seeds, mustard seeds have smooth surface, and when pressed, it is yellow inside. Argan seeds have grainy, rough surface and are black in color. When pressed, it is white in color. Okay, inside is white. But they look very much alike. Both of them are very, very similar in their look. Again, sugar and salt. What do you add? People add chalk powder to it. People add white sand, washing soda, plastic crystals, a lot of things. Here, this chalk powder is not toxic, but it can cause respiratory problems. Washing soda causes diarrhea, nausea and vomiting. So here again, sugar and salt, 2 of the most common things which we use. You are having this. Then again, white powder in iodized salt. Pure salt dissolves completely and gives a clear solution. But this, if it's in the presence of chalk powder, it becomes hazy. Okay. So you just add salt in a glass of water. Don't have to add anything else. This is a pure salt on the left side. Right side, adulterated salt. And again, same chalk powder in sugar. You dissolve it in water. The adulterant will settle down at the bottom, the right side. Okay. So we have it even in tea. Even the tea leaves, adulteration is there. In fact, adulteration is there everywhere. Again, this can cause cancer and tetanus. And so again, detection of tea. How's the tea bag? How's the tea? If it's adulterated, spread it on a filter paper. If it's adulterated, it will be spread out in a very haphazard manner. But otherwise, it will remain like this, pure tea. Turmeric powder, haldi. Haldi is another one which is quite common. You add aniline dyes added to it. It's carcinogenic, and also, this can cause a lot of things. Cancer is the most important thing. Adulterated with the aniline dyes, non-permitted colors like tapioca starch, lead bromide powder. And here again, you can test for turmeric powder, add it to a glass of water. The solution will be like this. If this is adulterated, you get a solution on the right side like this. Okay. And again, non-permitted colors can cause hyperacidity, can cause allergies, liver damage, infertility. Even the paper. This is a metallic silver paper which is used for sweets like barfi and all. That also can cause problems. So again, coming to the next one, fish and meat. Fish and meat are also, they can cause problems. Fish, if it's mixed with formalin, and other types of chemicals can be carcinogenic. And meat, they usually cause food infection, not any cancers or anything. But mercury in fish can cause contaminated disease. So fish also can be adulterated, sometimes intentionally, sometimes unintentionally. So what is the reasons for adulteration? Basically, the trader wants to increase more money, he wants more money, he wants to change this thing. So he's giving less quality, less quantity, less quality things, and he's cutting down the shortage of cutting the product cost, shortage of authentic ingredients, and the shortage of qualified personnel also, and inadequate knowledge on the consequences and associated food safety risks. So, so to overcome this, we have had this act called the Prevention of Food Adulteration Act, or PFA. This often comes as a question, PFA, what is PFA? So as I said, in the exam, please write what is PFA. If you write prevention of food adulteration, you will get 50%. If you leave it blank, you will get 0. Okay. So it was enacted first way back in 54, then changed again 64, 76 and 84. The aim of this act is to ensure pure food to the consumer, protect the consumer from fraudulent and deceptive trade practices. So the punishment is that if you can prove adulteration, 6 months imprisonment and fine up to 10,000 rupees. Adulteration causing hurt, grievous hurt to the death, life imprisonment and fine of 5,000 rupees. Okay. Then you have a few terms which is there in the textbook. Short notes may come on this. Just remember that Codex Alimentarius, that's a organ of the joint organ of Food and Agricultural Organization and WHO. Based on that, our standards are based. The Indian food standards is largely based on what is called the Codex Alimentarius. Next one is the PFA standards, again to maintain a minimum level of good quality foods attainable under Indian conditions. Then you have AgMark standards and you have the ISI mark. These are all guarantees of good quality. It's not easy to get a ISI mark or AgMark or things like that. But all these are based on this Codex Alimentarius. Okay. So food standards in India are based on this. And this is the most important thing, FSSAI, Food Safety and Standards Act of India, established in 2006, and everything comes under that, including PFA comes under that, including cooking, everything comes under this thing. Okay, it's a very big act. It has your small restaurants, your dhaba walas, and everything. Okay, so it consolidates all those acts together. Then last part, which is not there actually in your syllabus, I mean the class, but you have to talk about this also. Food intoxicants. We talked about food fortification. We talked about food. After fortification, what did we talk about? What did we talk about after fortification? After food fortification, what did we talk about? What is the next topic? Food fortification, food? Key. After food fortification, what did we talk about? Huh? No, between fortification and adulteration or something else. What was it? Additives, yeah, additives. So try to consider it, okay? Don't just jump. So we have, due to naturally occurring toxins in some foods like lathyrism and endemic ascites, this is common in a common short note. It's also called thiora dal, lag dal, batra, gharas, batra. Okay, and this is, if it's more than 30% dal taken over 2 to 6 months, it can cause paralysis. So the toxin is BOA, beta oxalyl amino alanine, and you have latent stage, no stick stage, 1 stick, 2 stick, and finally crawling. So this was there initially in the Far East and all. Now only India, Bangladesh, and Ethiopia. Okay. So we still don't know why the paralysis occurs, but we know it's related to the kesari dal. And even animals like the horse also have paralysis after having the same dal. So between the age group of 15 to 45 years, that is a productive age group. That is the time when you have this kesari dal. First, the patient is just walking with an unsteady gait, and then otherwise normal. Then comes no stick stage when the patient walks without the help but with short spaces. Then comes 1 stick. Then he's walking with 2 sticks and finally paralysis. Okay. So this is the picture of neurolathyrism. Often a short note is asked, or the examiner may ask you what is lathyrism, what is neurolathyrism. Okay. So what is the current prevention? One is you give ascorbic acid that prevents the toxic effects. Banning the crop, removal of toxin by agricultural methods, soaking in hot water soaking the dal in more than hot water for more than 2 hours, parboiling, soaking in lime water, followed by boiling, then education, health education, genetic approach, and also socio-economic changes of the population. So, as I told you, many states did not ban it. Chhattisgarh, West Bengal also did not ban it till 2000. And then the people started getting agitated. What will the poor people eat? But then they also had to change their stand. Finally, they are saying that it's still available, but you have to be careful how you take it. Okay, so it's still not officially. It's not a full complete ban on this. Then you have botulism. Botulism is basically staph poisoning, and here it is caused by children. It can occur to children. Here what is happening is lethargy, weakness, poor feeding, constipation, and in adults, older children, you have double vision, child cannot see, etc. This is often caused by eating home canned foods, home canned fish, herb infused oils, etc. Then aflatoxin, this is a hepatotoxin, causes damage to the liver, it can cause cirrhosis, and again this is caused by the fungus, and it's caused by storage of foods after drying. If contaminated, it should not be consumed. Okay. So these are the things which are there. Aflatoxin is one. Another thing, and here again, the storage is a big factor. Aflatoxins, the B1 and G1 are the great hepatotoxin. And it's in 75 there were deaths of due to this, and also aflatoxin B1 has been detected in people in milk and urine and collected from children suffering from infantile cirrhosis. Then ergot. Ergot is a fungus again. This can cause cramps, it can cause nausea, it can cause giddiness. And here again, you have to remove it by hand picking, flotation in 20% salt water or air flotation. So this is another fungus which is potentially harmful, ergot. Okay. So this is two things. One is the mustard plant and the other one is argamon plant. Both of them look very similar. So mustard, left side you have argamon plant, fallow fields harvested in May, blackish brown but wrinkled. Here slightly different, harvested March, blackish brown, and there is no growth underneath it. So this resembles mustard, isn't it? Mustard and argamon do resemble each other. The seeds also are similar, but the specific gravity of mustard seeds is more than that of argamon. So seeds of argamon will float, okay, in normal saline solution. The problem with that is this. Argamon can cause this problem for children. It can cause what we talked about neuroatherism. This is something else. Here you have a principle which is called sanguinolin. It inhibits sodium potassium ATPase, and also it's a reactive oxygen species. So what happens here is that there is edema, state of hypovolemia, capillary proliferation, leading to shortness of breath, and hepatomegaly. So clinical features again, illness begins with gastroenteritis, but there is edema. Edema is an important thing, nausea, vomiting, diarrhea, cutaneous erythema and pigmentation, swelling of hands and foot, respiratory cough, shortness of breath, orthopnea, right side heart failure, eyes, retinal hemorrhage, and glaucoma. So this is called what we call epidemic dropsy. The term is epidemic dropsy. What is epidemic dropsy? It is caused due to argamon poisoning, and these are the features. It's largely clinical diagnosis. All groups except breastfed infants. Many members are exposed to the same thing. Like all of the family will be having similar symptoms. Symptomatic only treatment: diuretics, bioxidants, steroids, vitamins, calcium supplementation, protein-rich diet. And here again, you have to prevent exposure to the factor. The main presenting factor is argamon seeds. Then secondary intervention to treat the patient, and strategies to destroy the argamon seeds wherever they are, and prevent outbreaks in future, and health education. So this is a major thing. Food Adulteration Act, mustard oil is added to it and that causes epidemic dropsy, which is dangerous. Okay. So you have screening tests also for that. Screening test is nitric acid and ferric chloride test, and paper chromatography test is there, which is a confirmatory test. They test the blood and urine from epidemic dropsy. Okay. So now we come to last 2 slides. I talked a lot about this, but I just want to tell you, your exams are, you have exactly 6 months, out of which 1 month will be gone in puja and your study leave. Okay. So here are the questions. Possible questions, listen to the question, read the question properly, think of the answer, whether you know the answer now. I've taken a class, adulteration and addition not the same. Explain. Can you answer? Can you answer? Yes or no? Adulteration and addition not the same. Explain. Second one is explain the difference between food fortification and adulteration, giving suitable examples. Short note, epidemic dropsy, lathyrism. Very important. Then again the same thing, all adulterants are not, all additives are not adulterants, explain. Short notes, IDD, that is iodine deficiency disorders. Again past questions, pasteurization, PFA Act, FSSAI Act, iodization of salt is a good example of fortification, explain. Short term vitamin A is useful for prevention of xerothermia, explain. Vitamin A deficiency leads to ocular and extraocular manifestation, explain. So these are the common, these are the questions which have come, some of them have been repeated. So please take care of this. Take home messages is read the past questions and go through the presentation which I made. Of course, we had a lot of breaks in between, the light went off and so on and so forth. So of these things, food fortification, food adulteration, food additives is not that important. These 2 are very important. And there are many things what I taught you, epidemic dropsy, neurolathyrism, IDD, etc. Okay, thank you.